everyone! So welcome to my second video for my childbirthing classes. Today is going to be a shorter video and we're just going to talk quickly about pregnancy and what you can expect in the first, second, and third trimester as far as your visits go with your doctor or midwife. Alright, so first trimester. This goes from fertilization until 12 weeks. So the heart rate can be detected on ultrasound and fetal Doppler around 5 to 6 weeks and 15 to 20 weeks on a fetoscope. So your first appointment is going to be around 8 to 12 weeks. If you've had trouble conceiving or you've had losses in the past, your care provider might see you earlier than that. And then another thing that you can do if you really need to confirm pregnancy is you can call your primary care and just go in and get a blood test done, and they'll be able to tell you from the blood test if you're pregnant or not and possibly how far along about you are. So some common things that you might be feeling with your first trimester would be morning sickness. You can get a taste of like metal in your mouth. This is always how I know I'm pregnant. I get that metal taste. And then fatigue. You can be very tired. I'm not sure if I said that already, but anyways, morning sickness is common and that happens in about 80% of pregnancies. So there's a few things that you can do if you're experiencing morning sickness. A few of them are natural ways, and that would be if you get the C-bands, which I meant to put over here so I could show you, but they look like a little like bracelet, almost like an elastic. And they've got a little ball on them, and the ball goes about right here and it presses into your pressure points there on both sides. And you can wear these and they can really help with the dizzy part that makes you feel sick. So those are a great first thing to try. Another thing that works well for people would be to drink mint tea. Lemon is also really good for nausea, so you can add lemon to your water, or just eating sour things could help. And then if you have really bad morning sickness, your provider might prescribe some medication, and there is like a prescription one, or you can get an over-the-counter. And if they're doing over-the-counter one, they'll probably tell you to take Unisom at night and B6 in the morning. Just be aware that they might not tell you the risks that this comes with, so make sure if you are thinking about doing that, that you go and do some research to see the risks that come with that. I know for me personally, a nurse just told me to do it and sent me on my way and didn't tell me any of the possible risks, and I had to go and find those on my own. So definitely, if you're considering it, just look it up, because you need to know the risks versus the benefits to make a good decision. And then there is also some homeopathic medicine that you can take, like the little balls that you put under your tongue. And you can do some research on that as well and decide if that's a route that you want to take. But definitely there's some options out there. I know morning sickness can be really hard. Just try to make sure that you're getting enough liquids and that you eat what you can. And then some ways that a doula can help you in the first trimester would be if you're feeling very nauseous and you're having trouble with eating and stuff, we can come over and do some food prep for you. We can run errands if you just can't get out of the house. Drive you to appointments, and then we can give you advice on some natural ways to help you with some of your symptoms, and we can help with nutrition as well. Just give you some basic ideas about what kind of foods you could be eating in your first trimester. Alright, so then we get into the second trimester, and that's going to be from 13 to 27 weeks. A lot of people find this trimester to be the easiest one, because hopefully by then your nausea has decreased a bit and you're not quite as big as you'll get in the third trimester, so you're not terribly uncomfortable. I definitely like the second trimester best for both pregnancies. It's definitely been easier for me. So some fun things that you can expect in the second trimester would be to start feeling the baby kick and move. For first-time moms, that typically happens around 20 weeks. For subsequent pregnancies, you might feel it a little bit sooner. I think for my first pregnancy, I felt it probably around 19 weeks, and this time I felt it around 16 weeks. And you could also delay your feeling if you have an anterior placenta, which is when your placenta is in front instead of in back of the uterus, and that can kind of block the baby's movement, so it might take a little bit longer for you to feel them. I've heard some women go throughout their whole pregnancy barely feeling anything because of that. For me, I had an anterior placenta this time, and I felt kicks at 16 weeks, so it definitely just depends on your baby and the placement and everything like that. So don't get scared. As long as that baby's heart rate is good and growing, then you don't need to worry if you're not feeling them at a certain time. So you also will probably start to show, if you haven't already, in your second trimester. Everybody's bumps are a different size, so don't worry if somebody else you know has a different size bump than you at a different week. As long as baby's growing right on track, then it doesn't really matter. And some things that you can expect during the second trimester as far as your visits go. Sorry, my son is right there with the new kitten that we got, and they're distracting me. But testing that might happen in your second trimester would be gestational diabetes. And for most people, if you're going to be delivering in a hospital, they're most likely going to ask you to drink that orange drink, and then you have to get your blood tested after so many minutes of drinking that. And then there are other ways to test this. There's more natural ways where you can just eat something more sugary, and then they can take your blood. So if you're not interested in drinking that drink and you want to do some research on that, definitely do it, and then ask your care provider if that's something that they offer. I know home birth midwives might be more likely to offer some other alternatives, but it's definitely worth a shot to ask your care provider what your options are there. And then some things that you can do during your second trimester would be, if you haven't already booked a doula and you're thinking about it, it might be a good time to start doing some interviews with potential doulas and to see which one might be a good fit for you. Okay, third trimester is going to be 28 weeks until delivery, and I say until delivery and not until 40 weeks because it is very common to go over 40 weeks, and that is fine. So first-time moms typically do go over 40 weeks. If mom is good and baby's good, then you don't really need to worry about going over 40 weeks. And we'll talk more about this when we do our interventions video, because I want to talk a lot about induction and the risks and benefits of that. But just know, just because it's your due date doesn't mean the baby is actually due, has to be here that day. It's just a guess, and baby knows when it's time to come. So some symptoms that you might be feeling in your third trimester would be water retention, fatigue, sciatica, and Braxton Hicks. So a chiropractor is a great thing to do or to go see if you have backaches or sciatica in your third or in any part of your pregnancy. They can also help get baby into a good position. So I know a lot of women like to go see the chiropractors throughout their entire pregnancy just to make sure their body is aligned, because you're doing a lot of growing and stretching and changing, and it's nice to make sure that that's all set. And you know, if it's gonna get baby in a great position, then it's definitely worth a shot. So I've been seeing a chiropractor this pregnancy, and I'm gonna do it the whole time, especially towards the end, just to make sure that baby's in the perfect position for birth and labor. And then if you haven't already, you can decide on pediatric care for baby and kind of just decide what is important to you and a provider for the baby, and make some calls, ask around, and see who might be a good fit and who is taking new patients. The Group B strep test is something that they'll most likely do at the end of your 3rd trimester. And there's some good information on evidencebasedcare.com if you want to read up on what Group B strep is and the benefits and risks of. So if you're positive, they tend to want to give you antibiotics during labor. So that's a good website to go to see the benefits and risks and decide for yourself if that's something that you want to accept or decline during your labor. And to talk to your care provider about any concerns that you have regarding that. Also, you can say you don't want the test at all, and that's a conversation that you can have with your care provider as well. With anything that they ask you to do, you can always say no, but it's good to have, the risks and benefits and decide that for yourself if that's what's best for you and your family. So some things that you should or you can do during pregnancy, no matter what trimester it is, would be self-care. So baths, going to the chiropractor, maybe prenatal massage, meditation, good nutrition, and getting plenty of rest. Your body is doing a lot of work, so make sure that you're giving it what it needs. Okay, and then if you haven't done it already, you're gonna want to make sure that you have your birth plan or your birth map all set up and in place, and that's something that a doula can definitely help you with. Birth mapping is something that I plan on providing for all of my clients, and I'm also going to offer it to people who don't necessarily want labor support, but maybe they just need help doing your birth map. So definitely reach out to me if you have any questions about that, and I'm happy to help you and just give you the options that you have so you can pick which one is right for you. All right, thank you. I know this was a pretty short video. I just wanted to quickly go over it. Next week, we're going to go over labor and delivery, so that's obviously going to be a bit longer. And then after that, we're going to go over interventions, which will probably also be a bit longer. But thank you guys. If you have any questions regarding anything that I touched base on, definitely let me know. Thanks.